Hello, good morning. World Health Organization predicts that the prevalence of chronic obstructive pulmonary disease will increase continually, and by 2030, COPD will become the third major cause of death around the world. In China, a previous study indicated that the overall prevalence of the disease in people older than 40 was 8.2%. Anxiety is a common comorbidity in patients with COPD in China, which can decrease patients' quality of life significantly and cause self-reported functional limitations. However, in China, there is no standard measurement tools to measure anxiety of patients with COPD. Besides, most all of anxiety measurements contain somatic items that overlap with symptoms of COPD and side effects of medicines, which can lead to bias in measuring anxiety. Therefore, a brief disease-specific and non-somatic anxiety measurement scale is needed for patients with COPD in China. The anxiety inventory for respiratory disease was developed by Professor Johannes and his team in 2013, which has been validated a brief, non-somatic, and disease-specific self-reported anxiety tool for measuring anxiety in patients with COPD. Based on this English version scale, we decided to translate the AIR scale into Chinese and test the psychometric properties among patients with COPD in China. Our study indicated that the Chinese version of the AIR has acceptable levels of psychometric properties and is a reliable and valid instrument for measuring anxiety in Chinese COPD patients. It might be useful as a sensitive tool for measuring anxiety in Chinese COPD patients. However, our study was a cross-sectional study with suggested longitudinal research will contribute to validate the sensitivity of anxiety and clinical variables in future. And future studies should recruit more participants from different regions in China to replicate these findings. Thank you.